Tātou mā tēnei Ngati whātu e tu ake nei. E tu ake nei ro te aroha te tahi ki te tahi I raro I tērā maru o te rangi Māori. Te mea tuatahi ki ato ana te rangi Māori I rungi a tātou katoa. Mihi ko ake nei ki te rungarawa e hāngai tēnei ao. Tēnei ao rangi hine ngaro. Ake tonu atu. Hei whakakākahutia I a mātou I a tātou hoki ngā wao mua tai atu ki tēnei I ngā rā ki te haere mai I roto I tērā korowai. I roto I te tika te pono te aroha. Ngā mihi kau ake nei kia koe. Mihi kau ake nei hoki ki Ngati Pikiao, te Runanga, me te aroa hoki. He hāngai tēnei kaupapa, e pāneki tēnei, he manaki tia ngā whakatipuranga. He mohio ana mātou hoki, wera āhuatanga, wera whakaro, e pāneki te whakapapa, ko wai ahau, e aha tōku rangatira. Mohio ana mātou tērā āhuatanga I ngā wao mua, e pāneki te whāngai. Nō reire tēnei katoa kene, mihi ko akene ki a tātou katoa I te āriki hoki, I te kāno tō whakaaro, e nanahi rā, ka hakarongo mātou ki ngā kai kōrero, ngā whaiaranga tira, ngā rauranga tira hoki, miharo ana. Nō reire tēnei katoa kene, ka whakawhanaunga tia ki tāku nei whanaunga a Marama Parore hoki, me tō tātou nei whaiaranga tira hoki. Nō reira tēnā koutou, kia ora hui mai tātou katoa.
Tēnā koutou katoa. Ki te taho tōku pāpa ko Ngati whātua, ki te taho tōku māma ko Ngati kahu I ngāri takukāngi ki Monique, ko Marama tōku ingoa. Ko au te pauahorangi mō te rau matatini. You know, many years ago, I was speaking at a conference and I was asked, all of the speakers were asked actually, please tell the audience, answer this question, being Maori is. And I was in really esteemed company, which is like I am today, which is hugely intimidating. And lots of people had lots of things to say. And so when I got up on stage and somebody said, Marama, answer the question, being Maori is, and I said, lucky and blessed. And you know your tupuna are with you, eh? You really do know your tupuna are with you. When driving from the airport here in Rotorua this morning, who was on Radio New Zealand News? Matua heke nuku mai Busby, talking about Waka Hourua. What is with that? And then I get here and I am always in awe when I hear my tuakana whaianaida speak, always in awe, and she reminds me how important it is to be the very best grandmother I can be of my 10 mokopuna, and how my job is sacred and vital and important, and it's my job to make sure that korowai aroha is put around my mokos all the time. So I'm here today with Monique. I'm going to stop talking now because I want Monique to come up and introduce herself, and then we'll start talking about Waka Hourua.
Malolelei from the Kingdom of Tonga. Kia rana koutou katoa from the 15 Pearls of the Cook Islands. Whakalofalahi atu from the Rock of Niue. Nisam Bulavanaka from the Republic of Fiji, Malo Ni from the isolated atoll of Tokelau, and from Samoa, with today marking the first day of Samoan Language Week for Aotearoa. Whaamalo atu ilipaia malema malu malava. Ua au fia le nei aso, talofa, whaatalofa atu, malo lava soifua, tēnā koutou, tēnā tātou katoa. My name's Monique Faleafa, hailing Ni Nyumata, hailing from Lano village at Savai and Fusi at Sawhata in Samoa. My Faleafa surname is my tane, Reese Faleafa, hailing from Golomutua in Tongatapu in Tonga. I'm a clinical psychologist and the Chief Executive of LEVAR, our National Pacific non-government organisation led by Pacific for Pacific. serving our communities. I really want to acknowledge the tangata whenua here today of Te Aroa. It's been said that Pasifika, while we whakapapa to the people of this place, that we're not mana motuhake here. And we're still trying to figure out our space, actually. Generation after generation here, people of the Pacific in New Zealand. And we're trying to figure it out because we're so far away from our homeland, our motherland, we're so far away from our islands of origin, but we have similar social issues. We have decades of disparities and inequities and inequalities. And we know that for suicide, it's an ethnically disproportionate issue. So we have our young Māori youth at 2.8 times higher than the general population of youth. Our concern for Pasifika is that we have a suicide attempt rate 3 times higher than the general population. So one way of addressing this is by working together, supporting each other, and attending and addressing our most at need. And that's an honour and a privilege to work with Te Reo Matatini and Marama here today. Waka Hourua is our double-hulled canoe that represents our strategic relationship between Lava and Te Reo Matatini. From the Pacific Islands, we have the same wakas. In Samoa, we have the Alia, in Tonga, the Kalia, in Fiji, the Drua, and so forth. And for us today, it symbolises Māori and Pasifika, acknowledging our shared ancestry and genealogy of Polynesia, but also symbolising us working together, navigating waters that are often uncharted waters for us, but always having a shared same destination. We have a Tongan proverb, takanga fohi, meaning unison of oars, and we really want to row together in rhythm to that same destination, and that destination is preventing suicide in our communities and supporting resilient and flourishing Māori and Pasifika families. I really want to acknowledge Dame Tariana Turia while I'm up here. She's a true sister of Pacific, and for the last few years when she's in power, she's really done a lot for our communities. And through those actions, Dame Tariana, you've really instilled hope for so many of our Pacific communities, and we're keeping our promise and we're instilling hope. We're paying it forward. We're instilling in hope in our communities because of all the work you've done. I also want to acknowledge the Ministry of Health. Through the Ministry of Health Suicide Prevention Action Plan, they've prioritised our 4-year program for Māori and Pacific communities in suicide prevention nationally. And I think just by putting it in there as Action 1.1, they acknowledge that, yes, it is an ethnically disproportionate issue. So for the first time, this is our first Pacific National Suicide Prevention Program ever in history. So we really want to thank all the people that have contributed to it, making that happen. We have 5 interrelated and interconnected streams that we're going to talk about, and I'll hand over to Marama to start that.
So 18 months ago, Ministry of Health conducted a proposal process seeking requests for proposals from organisations to run a national Māori and Pasifika suicide prevention program. At that point, they decided that Lava and Te Reo Matatini should work together collectively on our program. Unfortunately, at that time, they tried to make our relationship a contractual one. Never works, eh? They forget that we're the people who navigated Te Moana Nui a Kiwa. We're the people who navigated the whole of the Pacific Triangle. We know how to work together. We don't need a contract to tell us how to do that. But nevertheless, you know, we did have one. We are fortunate to have the 4-year Waka Hourua program. We are serious about the Waka Hourua, the double hold waka. We're fortunate to have a leadership group chaired by Professor Sir Matua Mason-Jury, who was so generous with his time, his support, his guidance, with the leadership group from both Māori and Pasifika and members of the Ministry of Health. They meet every quarter, and every year they have to run a national hui whono, Waka Hourua hui whono. This is my party political advertisement. This year it will be at Healing Our Spirit Worldwide, which will be held in November in Waikato Tainui. You can find information. I think my team are going to be handing out the pamphlets for Healing Our Spirit Worldwide. So very fortunate that our work is guided by this group of connected people. Maori community program that is currently under development. I understand that two of my team are going to be presenting in detail this afternoon, Mapihi and Dr. Kahu McClintock, who leads my research team. Ko au, ko koe, ko tātou. Makes sense, particularly listening to what Whaia Nader was talking about. It's about you. Yeah, I am pointing my finger at you. And it's about me, and it's about all of us. I really believe in the power of joined up thinking and joined up working, because we ain't going to get it right if we can't work together. So this program has 4 components. I'm not going to go into depth in it because you've got a workshop this afternoon, but suffice to say that we have Pauarahi now working in different regions throughout the Motu with kaitiaki, which is really critical. So we've got these people called Pauarahi in 6 different regions being guided by local kaitiaki, such as Papahuatahi in Tairāwhiti. There is a question I know that is on many people's minds that this hui, kia piki te ora providers, some of you are here, what's the link between the two? I go back to what I just said, we've got to work together. Ko au, ko koe, ko tātou. And so I know that certainly I want to be having conversations with kia piki people while I'm up here. Ko au, ko koe, ko tātou is about community development. It is about solutions coming out of our own communities. It does seek to unleash the excellence that lives in every one of our communities, and that's what Whaia was just talking about. It's not Wellington knows what's best. We will decide. We will spend this scarce resource on an over-engineered, over-specified contract telling you what you must do. It's quite brave, really, on behalf of my Ministry of Health colleagues. Quite good, really. And I just say to them, be careful what you wish for. Because at the same time, this time last year, they gave us a fund of $2 million. And they wanted us to administer it. We put in place the mechanisms, the process to administer this community fund of $2 million. Sounds good, it's not really, it's not very much, actually. I'm currently looking to see what they can extend that by. But we used that $2 million, sent out information to communities and said, tell us what you want to do. Tell us what you're already doing, and tell us what else you want to do. And I've been really delighted by the breadth and depth of the programs that we've been able to support through this pūtea right throughout the country. And I really want to say to my Ministry of Health colleagues, if any of them are here, this was one of the best decisions you've made in the last 10 years, because you trusted us to get it right. Do we know we've got it right yet? Luckily, I've got Dr. Kahu McClintock, who works as part of Te Rau Matatini, and she's leading the research strategy and the evaluation strategy. So we'll be able to report back on that at the next national gathering of suicide prevention people. Again, they're going to be talking in detail about these workshops, but just have a look at the map and you'll see the spread that we've got throughout the Motu. Mika Haka Foundation is one of the programs, actually that's a joint program really with Māori and Pacifica, LGBTQ youth, really important piece of work. Te Tai Timu Trust, Ngā Waka o Te Tai Tukurau, I go back to Mato Heke Nukumai Busby, sharing his wisdom and knowledge with young Waka builders. Gee, it felt so, honestly, when I was driving on my car to this hui, I think, oh, they're looking at me. They know that I'm coming to this hui. This is once over lightly, but I have put some information together that you can take home with you to get more information about Waka Hourua, that my team sitting over there will be able to give to you during the lunch breaks. And again, they'll be talking to you at 2 o'clock. Dr. McClintock leads the strategic research agenda. This bit is critical. Waka Hourua is $10.4 million over 4 years. That sounds like a big number. It isn't. Let's get really clear. We are not going to fix this with $10.4 million in 4 years. But what we need to do, what we absolutely have to do, is to build and provide evidence that unique Māori and Pacific solutions are what works, is about sustainability. We have to do that. But at the same time, I have to be really clear that Waka Hourua does not absolve mainstream with their multiple millions of dollars of budgets from their responsibility. We can't do it on our own. So we're doing Maori research and Pacifica research. Really, really interesting research. Ngāropi Cameron and Taranaki, really exploring whānau issues, talking, gently, one-on-one with whānau, trying to understand, in a deeper sense, what's going on with whānau. That, in essence, for now, is the Waka Hourua Maori stream, and I'm going to hand over to Monique to talk about Pacifica for Life, FLOW.
So FLOW stands for lots of things, and to be honest, we've got an English name because none of the Pacific countries could agree. But FLOW, yeah, it's hard work. But FLOW, the F stands for for, the L stands for life, and the O stands for our actual flow in life. And FLOW is based on evidence-based positive psychology coming from a resilience, flourishing and strengths-based approach. So FLOW actually stands for our relationships and our interactions we have with our families and communities and the environment. And FLOW actually happens in the VAR. The name of our organisation is called Le VAR. And that we were named Le VAR by our communities, which it literally means the space between, not open space or expanse, but space that relates, space that connects. So it's about relationships that are tapu. And FLOW belongs in the VAR. We have really good flow when we're flourishing and hopeful and at our best. But blockages can happen in that flow, and they usually happen when our relationships are trampled on or tapu is breached. So FLOW, our focus is enhancing our flow, getting our flow on, and just living in that flow zone. Yes. Our actual program really is, the outcome is so that our Pacifica families and communities can prevent suicide and respond to it in the right way if it occurs. We need quality research and information. We also need to create and equip our communities with the right tools. So that they know how to do exactly that. And we need good leadership. This is our first time nationally, so we actually need the right leaders in the right place at the right time. And we need to be in that suicide prevention space. And today with us, one of our leaders is Josiah Tiakotai from Rotorua, who is doing a lot. We have ambassadors all around the country that do our work for us in their communities, and some of them are already doing it. They're just now contributing to our program. They really live and breathe the Samoan proverb, "Oleale le puli le tautua." The pathway to leadership is through service. And we know that we have a heck of a lot of leaders serving our communities. Because it's the first, we had to go up and down the country and talk to everyone about what they would expect to see in our first Pacifica Suicide Prevention Program. So we had 15 whānau nationwide. It was probably about 30, but we kind of just counted 15. They were ethnic specific, they were youth focused, they were LGBTIQ, rainbow, and geographically located in certain areas. What people told us, what we were worried about at first actually was the community's readiness to have a conversation about such a tapu subject. This was new. On a national level it was new. But our method was that we were standing on the pai, the grass field next to the open whale, and we were looking in the whale and seeing who was in there sitting around the kava bowl, because you need to know who's in there, their genealogy, their ancestry, in order to have that relevant and appropriate response. So what they said to us, our communities, was they are ready to talanoa. They're ready to talk, and in fact do it yesterday because there's a sense of urgency around our young ones. They also told us to be innovative and relevant with the resources. They want us to use vehicles that are relevant to our communities, so going through churches, going through sports clubs, using music, performing arts and social media, but doing it with a coordinated approach. And then they also told us, we don't want you to teach us, we want you to equip us with the right tools to teach ourselves. So that's exactly what our team are doing. And I just have to say, I've got the dream team here, led by Denise Kingi Uluave, who's a local. Actually, most of them are locals. Dr. Carlo Milashav, who was born here, Leilani Clark, and joining us, King Kapisi. And they're doing exactly that. They're piloting Flow Talanoa, a grassroots evidence-based toolkit, which will come out after August. And it's based on whānau ora and presented in a way that's really relevant and meaningful and intuitive for our Pacific communities. So keep an eye on this space. The Community Fund, I won't go into the detail, but what we love about the Community Fund, Marama nailed it, that it's just been so important and so successful. We have a Samoan proverb, e fōfō le alamea, and what it refers to is a poisonous starfish that if you stand on it, it could be lethal and you'll get really sick or you'll die. But if you turn the starfish over, there's an antidote in the undercarriage and you use that to get better. And what it's saying is the solutions lie in our communities. And that's how we see the Community Fund. And as long as we support them in the right way and measure the outcomes and upscale what works, I think that it's a win-win situation. I just want to acknowledge the Mental Health Foundation, Lifeline, CASA, and all the partners that contribute to our program. We spend a lot of time talking to people that are already in the space, and we've learnt so much from you, so thank you very much. I know that so many people in the room have been touched by suicide and gone through the experience of losing a loved one who has taken their own life. And as a clinical psychologist, and from my personal experience, I know that this tragic issue, what I've seen is that our people, Māori and Pacific, don't really want to die. They just want a better life. And as a child of the migration, it reminds me of my parents who came to New Zealand for a better life. I think that they came to New Zealand with so much aspiration and resiliency and courage and the hope, and with so much hope, and their dream was for their children and generations to come to flourish and do well and flourish into the future. And our program, Flow and Waka Hourua, really uses and highlights that resiliency and aspiration and courage and hope. And it really emphasises that suicide is preventable, help is there, and that lives can be saved.
I'm just getting the hook. Matua Mason Jury has helped lead the development of the outcomes framework for Waka Hourua. We don't have time to go into depth, but it is in this little booklet that you can get from my team later on. Just finally, there's a group of us who have been invited, Monique and I have been invited, to the International Association of Suicide Prevention conference in Montreal in June. If anybody else is going, can I ask you to meet us over there before lunch, that table by the window? Because we should have a joined up voice from Aotearoa. As I said earlier, this is ko au ko koe ko tātou. We have to work together to support our whānau with the tools, with the resources, and most importantly, with that korowai aroha around their shoulders, wherever they may be. Nō reira, tēnei takumihi kia tātou katoa, tēnā koutou, tēnā koutou, tēnā koutou katoa.